Tonight's special segment, Fighting the War Within. Post-traumatic stress disorder is a psychological health crisis usually associated with veterans. But it can be triggered by any traumatic event, such as a car accident or physical assault. Some people don't get better with conventional treatments. Now, an area doctors say an injection commonly used to control pain can also help. The sights and sounds of war. For some veterans, the images and feelings don't go away.
A lot of the dead bodies, the destruction, telling people to do things that could get them killed, I mean, that weighs a lot.
After two separate tours in Afghanistan and Iraq, 35-year-old Shane Wheeler made it home with no physical wounds. He thought he left the war behind, but the memories stayed.
I seen a few of my friends, they died in front of me. I think that put me over the edge.
Shane now suffers from post-traumatic stress disorder, or PTSD. Symptoms vary, but for many it involves reliving traumatic episodes. Researchers believe part of the brain becomes stuck in an overactive state.
I haven't been able to function with a normal life since I got back.
And that's why Shane has traveled from Radford, Virginia to Hoffman Estates. He is hoping an experimental procedure involving an injection in his neck will work. It's called a stellate ganglion block.
Is to reset the area of the brain that has now become abnormal, where they have this heightened sense of excitement.
Dr. Eugene Lipoff and his team have been doing this procedure for years to treat severe hot flashes, and now they say it appears to work on PTSD patients. Shane is the second veteran to give it a try. A common numbing medication is injected around a group of nerves in the neck. Dr. Lipoff says the medication quiets a substance called nerve growth factor, involved in triggering the overexcitement in the brain. The procedure is quick, and the patient leaves with just a Band-Aid.
It seems to work between 3 months to 6 months, maybe 9 months. My projection will take probably 2 to 3 procedures per year.
Curtis Noblett at the Hines VA Hospital is a PTSD specialist. He supports efforts to find newer options, but for now says he's skeptical about this treatment.
I'm also going to be a bit skeptical about treatments that claim to be a quick fix. PTSD is very complex with a whole host of symptoms, problems, associated difficulties that, in my mind, needs a broader approach to treatment.
Shane says he tried more conventional treatments, but nothing seemed to work. After his first injection, there wasn't much change, but after the second, he now feels calmer and less anxious. Shane is also hoping that means he'll eventually go back to being an EMT.
Well, you got to be mentally strong to be in that kind of position, so I mean, we just have to wait and see what happens, and I'll go from there.
Dr. Lipoff says he has been in contact with pain specialists with the U.S. Army. He says they are in the process of evaluating this as a possible treatment for PTSD. The VA says this technique is experimental and there are conventional therapies that work. The key for every patient is getting diagnosed and then finding the best treatment that works for them.